invite my first speaker. So Hayden, whose presentation is entitled In the Balance, a Qualitative Analysis of Risk and Benefit Perception in Kidney Donation in the African, Caribbean, and Black Communities. Hayden is a Queen's medical student and a research trainee with what's KHERG? Will you spell that out for me? Investigates barriers to living donor kidney transplantation in African, Caribbean, and Black communities. He's involved in the A.C.T.I.O.N Project under Dr. Istvan Mucsi's guidance. Hayden is our 4th Rising Star Awardee, and this award was made possible by a CHR Planning and Dissemination grant. So please welcome Hayden.
Thank you so much, and thank you so much, Dr. Sandall, for providing a great overview of the context of living kidney donation and the support needed for living kidney donors. So it's an honor to be here today, and I will be presenting, as stated, In the Balance, exploring risk and benefit perception in kidney donation in the African, Caribbean, and Black communities. So, as a background, I'm sure as many of you are aware, this figure highlights chronic kidney disease and kidney failure beginning at stage 1 of mild damage to the kidney and normal function, and can progress all the way to stage 5 at kidney failure. So for patients experiencing kidney failure, living donor kidney transplantation, or LDKT, is the best medical treatment option available. As compared to deceased donor kidney transplantation and dialysis, it offers improved long-term clinical and quality of life outcomes. And moving over to why the specific focus was for ACB, or African, Caribbean, and Black populations, they currently represent more than 4.3% of Canada's population, and they experience a higher incidence of diabetes and hypertension, which can put them at a higher risk for chronic kidney disease and kidney failure. Moving forward, it has been identified that they are 47% less likely to be a living donor. And this has downstream effects of being 51% less likely to having living donor candidate identified by their first pre-transplant assessment. And secondly, they're more than 50% less likely to receive LTKT, resulting in poor health outcomes. So this is all compared to white populations, and is ultimately why I am exploring the perceived risks and benefits, as they've been proven to influence living donor candidate decision-making. So ultimately, as stated, the purpose was to focus on understanding risk and benefit perceptions related to kidney donation among individuals from ACB communities, specifically in the context of the Greater Toronto Area of Ontario. So moving forward, just 2 key terminology here rooted in health behavior theory, but perceived risks and perceived benefits are either just the anticipated negative or positive consequences to a particular action. In the case of this is living donor or just kidney donation in general. So in terms of the methods, there was a recruitment of both patients with lived experience of chronic kidney disease, as well as participants without. So for patients with lived experience of CKD, they're recruited on-site at UHN through purposive and snowball sampling. And then for participants without, they were supported by the recruitment by Black Health Alliance's community networks. Moving forward, there's a total of 8 semi-structured focus groups, which were taken in person through Microsoft Teams, as well as through telephone, and were all audio recorded and transcribed verbatim. Lastly, the data analysis involved the reflexive thematic analysis informed by critical race theory, which I can define later, and uses both inductive and deductive coding strategies through in vivo 12. So as you can see from the study participant demographics across the 8 focus groups, there's a total of 90 participants. The majority were over the age of 60 years at 70%. They're predominantly female at 63%. And then the majority were first generation immigrant status, decreasing from there in the second and third generations. So given the time constraints of the presentation, I'll be focusing on a few of the key themes out of these 3 categories, but I'm happy to explore more with any of the others. So first is the category of perceived risks of living donation, then deceased donation, then lastly, the perceived benefits of living donation. So moving into the perceived risks of living donation, not being accepted into the afterlife was particularly significant and is also seen across many other groups. So this was under the belief that we want to go to the grave whole, stated by this community member, referring to their bodily integrity. So what this means is their belief is that if they were to donate their kidney, this would compromise their religious values and hinder them from either reincarnating or going to heaven. Secondly is increased vulnerability to health issues, as many of these participants either had families with chronic kidney disease or are aware of the increased prevalence as across ACB communities. They are concerned that if I give my kidney to someone and then something happens to the other kidney, how am I going to survive? So this is a really unanswered question for a lot of community members. And finally, is not being supported during organ donation, as across a lot of the ACB community members who had individuals who were involved in kidney donation in the past referred to there being no support system, resulting in negative health outcomes, and this caused them to be apprehensive as well. Then, in terms of the perceived risks of deceased donation, a common and very striking one across many of the participants was not receiving appropriate care by the healthcare team in critical condition. So what this means is that in the event that they sign an organ donation form and then happen to become incredibly ill or get into an accident, this would compromise their care once they get to the hospital. So this is described by these two community members saying they'll, referring to healthcare professionals, kill you quicker, meaning physicians would not provide adequate care for the purpose of harvesting their organs sooner. Secondly is a statement saying, I feel like I'm going to die, referring to the signing of an organ donation form, putting themselves at higher risk for actually being not cared for in a hospital. So lastly, just to end on a little bit of a lighter note, I know this is very serious topics here, is one of the main perceived benefits of living donation, which is confirmation of one's role in family. As something that was very shocking is through the protocol interviews, many of the perceived risk questions were at the start and then near the end were the perceived benefits. And many of these participants changed their overall view as compared to many of the perceived risks, something that was much more important than all was how they were supporting their family members. So in the context that a family member was in need of a kidney donation, an individual stated here, I'm the protector, referring to a role in their family, and actually donating a kidney to a sibling would be a fulfillment of that role and would be more important than the actual perceived risks that they had. Secondly is another statement by a community member saying, and if it's all loved one, and if it's loved ones, all that thought goes away, referring to another kind of decisional balance at play that requires further exploration in terms of the risks and benefits of kidney donation decision making. So, as you can see, there has been new insights provided into the perception of risks and benefits for ACB community members when considering kidney donation, and further research is needed through continued focus groups to fully characterize these risks and benefits to inform essential culturally responsive community and educational resources. And here are just two highlighted, the ACB Kidney Health Project and ACB Organ Health, which are currently actively working to design content specific for ACB communities. So last but not least, I would like to thank members of my research team. You asked what KHERG was. It's the Kidney Health Education Research Group led by Dr. Mucsi, and thankfully my qualitative supervisor, Rebecca Starkman. Secondly, the study participants, the Black Health Alliance for their support with recruitment, and then the University of Toronto's Institute of Medical Sciences CERT program was the platform in which I conducted this research. So thank you so much.
Does anybody have any questions for Hayden?
Thanks for that representation. Do you think this is limited to ACB community, or are there parallels with other communities in general?
Yeah, so what I initially influenced my research is research conducted in the same lab, the Chinese Health Equity Project, where they identified many kind of barriers to living donor kidney transplantation in Chinese communities, as they have many of the same stats of not receiving access to living donor kidney transplantation. So I did cross-reference across multiple cultural groups and people marginalized in not receiving living donor kidney transplantation. And just going back to some of the themes I highlighted, not being accepted into the afterlife was very consistent across many groups with kind of prevalence of religious values. And kind of a major concern also is increased vulnerability to health issues. Even earlier today, I spoke with Carolyn about Indigenous populations and kind of a longstanding belief of not receiving adequate care and kind of a root there in terms of mistrust in the healthcare system. One of the most shocking ones, though, was not being supported during organ donation, which was kind of very rooted in terms of a fear of actual racism encounters during the experience, which hasn't been captured in a lot of different groups before this.
Any other questions?
Thank you.